Our original due date for the twins was November 1st of this year, and we had the twins on July 28th, 2010, so they were 14 and a half weeks early.
The population that we see here in the neonatal ICU at the University of Colorado Hospital includes premature infants as early as 23 weeks gestation.
Our specialty here is extreme prematurity. I've been doing this for 35 years, and I remember 30-week babies being very difficult to keep alive and resuscitate, and now we're down to 23 weeks.
Grayson survived for about an hour, but she was so small they couldn't intubate her, so she passed away at 1 hour and 4 minutes. And Emmy's been just a rock star since then.
Initially, when parents come into the neonatal ICU and see their baby hooked up to monitors, I feel like they had this sense of fear because I think ideally they wanted to take their babies home.
We try to mimic the environment of the uterus because many of these patients have come out of that environment much too early. So we try to keep it quiet and dark, and so the covering over the environment that they're in obviously limits the parents as well as the caretaker's ability to be able to visually watch them and see what they're doing.
So the monitors are really helpful, especially for parents and then for nurses, of course, to always be able to know what their patient is doing.
It was definitely nice to have that education early on about the monitors and the importance of all the different numbers and what they meant.
Yeah, I think it was our first look into her world. Mm-hmm. Her main issue was she had apneic moments where she would hold her breath.
Bradycardia is a common finding in premature infants, and many times, not always, it's a result of the baby essentially forgetting to breathe because of the immaturity of their brain.
The monitors help us to catch that by alarming when the baby's heart rate or respiratory rate go below a certain parameter that we set.
With a lot of measuring capabilities and trending capabilities that allow us to determine if this is a problem for this particular infant and whether or not the baby needs medication support, different type of support that can help them until they essentially develop further along and don't have those problems.
The trending capability has been valuable to us because we can look back at an event that happened yesterday, 2 days ago, and it helps us make decisions about what we should be doing with that patient in preparation for discharge.
In total, we were there for 101 days. She was discharged on her 101st day. We feel really blessed to have gone down the road that we have, and just to have a healthy growing baby, you know.
And when you look at that progress, it's just really remarkable, and it's all due to the work that these nurses here and our physicians do.
We are so thankful that we were where we were, that we were at the University Hospital, where they have cutting-edge technology and cutting-edge research and just the best of the best doctors in the region. We really were quite blessed to be there.